Hello, everyone. I'm so happy to see you today. Thank you so much for coming to spend some of your Wednesday, October 18th with me, or perhaps it's Thursday in your part of the world if you're in Australia or New Zealand. I know that we have worldwide viewers, and we are going to continue covering today the Kowalski versus Johns Hopkins case that is pending out of Sarasota, Florida, that has been on trial for a couple of weeks now. And the defense just started their case the other day. And what I thought we would do is watch some of Maya's testimony today, because we have not watched any of Maya's testimony yet. It is, 5 or 6 hours long. We're not going to watch all of it, but just certain portions of it that I've sort of pieced out that I think are important. And I wanted to first address a couple of questions, because there are some questions that I have received a lot. So I wanted to take a look at some of those questions. If you have any questions that you want me to answer before we start today, please put them in the chat so that I can see them. But I'm assuming that if you are here with me today, you are pretty up on the Maya trial. If you are not up on the Maya trial, I'm going to give you just a little synopsis before we get started. So Maya Kowalski, at the time that these incidents that are the subject of this lawsuit occurred in October of 2016, was a 10-year-old girl, and her family was living in Venice, Florida. Her mother was an infusion nurse, an RN, who came over from communist Poland when she was 16 years old. Her father was then and still is a retired firefighter. I believe he was also a 9/11 first responder. And Maya had been diagnosed prior to her admission at Johns Hopkins, which is the subject of this lawsuit. Johns Hopkins is a children's hospital in Florida. Prior to her admission, she had been diagnosed with a very rare, very, very painful disease called CRPS, chronic regional pain syndrome. Used to be known as RSD, regional sympathetic dystrophy, regional sympathetic dystrophy. And it is the most painful disease known to man. So for those of you who don't know about CRPS, that is the one thing that you do need to know. And what you also need to know is that a lot of doctors are not familiar with CRPS, and it takes a very long time to get diagnosed. And there are many members of the chat who actually do suffer with CRPS. And so they are very knowledgeable. I see Sarah Adams. There you are. Hello. Good morning. Sarah Adams has shared openly that she suffers with CRPS and has for many, many years, and that it took a very, very long time to get diagnosed. I also have a lot of viewers in this chat who are suffering with chronic pain and other disorders that are difficult to diagnose: fibromyalgia, multiple sclerosis, and many other disorders that took a long time to get diagnosed. And so they are very, very familiar on the intricacies of this case and how difficult something like this can be to diagnose, and how oftentimes medical providers can be insensitive to the point where they tell patients they're making their pain up, and that it's not really true, and that it's all in their head, and it can be very frustrating for an adult to deal with. So imagine what it was like for a child who is only 10 years old, who had already been diagnosed with CRPS, to then be told when she's admitted to this children's hospital that it's all in your head, you're making it up. And her mother was also very knowledgeable about this disease, because it did take a long time to get Maya diagnosed. In fact, I believe when she was admitted, and I know that a lot of you are so much more familiar with the facts of this case and the everyday testimony than I am. But if you're just tuning in today, I come to you with 30 years experience. I'm a recovering lawyer. I have 30 years experience in New York State and federal courts. Civil litigation is my wheelhouse. Complex litigation is my wheelhouse. And this is a complex litigation case involving claims of medical malpractice, negligence, intentional infliction of emotional distress, false imprisonment. It is alleged that they kept Maya in the hospital against her will. False allegations of medical CA, we need to call it on YouTube, against Maya's mother, Beata. And other claims that are really too complex for us to get into for a short and quick overview. But you can read the complaint if you want to. It's the 8th amended complaint. It is very, very long. And we did go over parts of it. I don't know why all of a sudden my volume went up on my phone. And the only claims left right now are the claims against Johns Hopkins All Children's Medical Hospital, because certain other claims have been settled and certain other claims have been discontinued. So the case right now that is on trial is only against the hospital. And the plaintiff's case was on for many, many days. And a lot of people have been asking, let me just finish the quick recap. So what happens when Maya gets admitted to Johns Hopkins All Children's Medical Center? She has a flare up of her CRPS, and her dad takes her to the emergency room. And her mother shows up, and she's very, very, they call her belligerent. Some of the hospital's witnesses call her belligerent. They call her lots of other things. I'm going to call her a fierce advocate for her daughter. She had been undergoing some treatments that are, let's say, not conventional in the US or for children. But as some of my people in the chat will tell you who are afflicted with this disease, it's a trial and error of medications to try and alleviate the pain or at least distract you from the pain. And we've heard from Dr. Kirkpatrick, and we did go over his testimony together. And he was Maya's treating doctor who finally solidified the diagnosis of CRPS and put her on a regimen of what I'm going to call K treatments. YouTube keeps changing the rules about the things we're allowed to say and not allowed to say. And it's sort of like George Carlin's old stand-up routine, the 7 dirty words you can't say on TV. There are several words that we cannot say on YouTube. So if your comments in the chat get deleted, if you get timed out, please just know that it's only because certain words can't be said. And if they are, it screws with the algorithm. They, take the video off. They don't push it out. And I think this is a really, really important case for people to learn about, because for a lot of reasons, this can happen to you and your family. And people need to know about it, and we need to shine a light on this. And what do I mean by that? Because the hospital did not like the fact that Beata, Maya's mother, was advocating for her child with regard to these K treatments, and knowing that K was the only drug that had been useful in managing Maya's pain, they called in a report to the CA hotline and claimed that because of the treatments that Beata had been allowing her daughter to undergo, she had a diagnosis of Munchausen by proxy. Munchausen by proxy is a psychological disorder where a parent or a caregiver will intentionally make their child sick or cause their child injury to the point that it rises to the level of what they call medical CA. We saw a real live case of Munchausen in the Gypsy Road Blanchard case, which I did a recap on maybe 2 weeks ago. I don't even remember when, because Gypsy Rose was recently paroled, and her mother had been inflicting upon her several disorders that she did not have. She was intentionally making her sick. If you're interested in that case, you can go back and watch that live stream. But in this case, The hospital called the child abuse hotline, made a complaint against the mom. The initial complaint was dismissed. And then a day or two later, they made a second complaint against the mom, which led to a series of events that caused Maya's parents to have their parental rights stripped. And Maya then became a ward of the state, essentially. She was sheltered in place in the hospital. She was not allowed to have any contact with her mother other than an occasional phone call that was monitored by the hospital at the social worker at the hospital, Kathy Beatty, who you may recall, we watched her testimony in a prior live stream, and also by DCF, the Department of Children and Families, which is what they call our CPS in Florida. So Maya was 10 years old. She was in the hospital for over 3 months, and she had very limited contact with her mother. And after a court hearing in January of 2017, where Maya's mom asked the judge to let her give Maya a hug and was denied. She hadn't had any physical contact with her daughter in over 3 months. Beata took her own life. And the S word for that act is another word that we are not allowed to apparently say on YouTube, according to their most recent rules. And shortly after Beata took her own life, Maya was then released back to her father's care. Some very other horrible things happened during the course of these events, including Kathy Beatty, the social worker, suggesting to Jack Kowalski, the father, that he should divorce his wife because then he may be able to get custody back of his daughter. They denied Maya the right to receive communion in the hospital. She's Catholic. They took away her rosary beads. They took away her prayer book. They took away a lot of things from her. They would not let her have her school laptop in the hospital, despite the fact that she was unable to access any email other than her school email. She was not able to email anyone who was outside of the school. So in this lawsuit, they're alleging that they deprived Maya of certain rights under the Patient Bill of Rights. There's a lot of causes of action and legal doctrines. And as a 30-year experienced attorney, this case is very complex for me. So I can't imagine what it's like for the average viewer to be watching this testimony and thinking, why is this important? Why are they showing this? What does this mean? And a lot of viewers have asked, why are they showing deposition testimony of people like Kathy Beatty and Sally Smith instead of calling them in live to court? And here's why. That is 100% a strategic decision. When you bring someone in live and they could potentially be a loose cannon, you don't know what they're going to say. You don't want to give, and this is talking from the plaintiff's point of view. If you have their deposition testimony, you can parse out the portions that you think are helpful to you and use only those portions. The defense does not get an opportunity to cross-examine the witness because you're only showing the deposition testimony. And if you call in someone like Kathy Beatty or Dr. Sally Smith, you can open the door to certain things that you don't want in evidence, and they can also have a chance to rehabilitate themselves, and they could also have a chance to change their demeanor. And you remember when we watched their testimony, we were talking about their demeanor, and it didn't look good for the defense. It didn't look good. Tell me how you think about that. Somebody's indicating here there was a okay, hi Peter. There was a court order to keep her sheltered in the hospital. The hospital had no choice. Why isn't the court on trial? Well, they have immunity, number one. And number two, you have to think about this. You have to look at but for causation. But for the actions of the hospital, this chain of events would have never started, right? These proceedings never would have happened. These damages never would have occurred. So the hospital set in motion this chain of events that led to her being in the hospital for over 90 days. And in the plaintiff's position, caused the mother to take her own life as the only way that she knew to get her child released. And when you look at a case like this, you have to look at the mother and where she was coming from, her state of mind, the fact that they, inserted this diagnosis on her without any sort of expertise in doing so. This is a children's hospital. They don't treat adults. There's a lot of issues here. But Dr. Sally Smith was called in before the CA hotline was called. So you have to look at this from the point of view that they just maybe dealt with Beata, just told her they weren't going to give Maya these treatments to the extent that she wanted her to have them. They set in motion this chain of events. And when I went back to look at this case more thoroughly, this is not the first time that Sally Smith has been involved in false allegations of Munchausen. This is not the first time that a parent of a child who was given a false diagnosis of Munchausen, the parent was given a false diagnosis of Munchausen, took their own life. In fact, we watched Dr. Laura Vose testify that this same exact thing happened when she was an intern. And we looked at her text messages to another doctor that said, oh, sorry to say that my prediction came true. This happened before, happened another time. So, we should have seen this coming, or we saw this coming. The insensitivity that the hospital is showing by putting these witnesses out there, and the witnesses that they've already called to the stand in the past 2 days. I was listening to this trial in the car, and I had to keep reminding myself that it was the defense putting on their case now, because I'm listening to these witnesses and I'm thinking, wow, that's really great for the plaintiff. It's really great for the plaintiff. I can't see right now any sort of sympathy for the defense. And I know that there's going to be people in here who are going to come in here and be nice or leave. That's my message to you. And defend the hospital. But you need to look at the history. A lot of this is not going to come in, but it's not the first time the hospital has done this. It's not the first time Sally Smith has done this. And we know for a fact that it is not the first time a parent has taken their own life because of this. That is in evidence in Laura Vose's testimony. If you haven't watched it, go back and watch it. So let's just jump into this for a second. For those of you who have been following this very closely, tell me if you have watched all of Maya's testimony. And if you haven't, I suggest that you go to Tampa 13 to watch it. You can watch it also on Law and Crime. And I suggest that you turn the live chat off when you do watch it, because I have never on YouTube seen a more vicious live chat than I have seen in these streams. It is triggering. It is upsetting. And it's hard to believe that there are people out there in the YouTube universe. Well, I mean, I guess they're out there. We don't let them in here because we have some of the best mods on YouTube that are just saying horrifically insensitive things. I don't know where they're coming from, but they're out there. So if you're going to watch it, turn off the live chat so that you don't get triggered. Let's take a look at, okay, Sarah's watched all of it. A lot of people have been watching. Yeah, turn off the chat, Michelle, turn off the chat. It's disturbing. It's really disturbing. Let's put Maya on for a little bit. And then after that, I want you to see the testimony of Dr. Napolitano, who's going to come in and testify on behalf of the Risk Management Committee for the hospital, because that to me, is some of the most shocking testimony in this trial. I just want to give you a little taste of what Maya sounds like, what her demeanor is like. She's a great historian with regard to her medical condition. But I want to talk about, watch the portions of testimony where she discussed, it's too early. I haven't had enough caffeine, you guys, where she discusses her interactions with Kathy Beatty, because I think that's really important. There was not a lot of interaction with Sally Smith. Sally Smith did a 10-minute, not even an exam, 10-minute questioning of the parents before she made her diagnosis that set these events in motion. But let's just see what you think about what kind of witness Maya makes, because this is Maya's case. A lot of it's going to hinge on her credibility and whether or not the jury is going to believe her. So, and sympathize with her. All right, let me know that you can hear it. I'm not going to turn on the closed captions because they're so terrible. So let's just watch a little bit of her introduction so she can, this is really the first time she's speaking in front of the jury in this case.
So I hear with that announcement, Deputy Coley is trying to keep you on your toes. I want to confirm while you're away, you did not discuss this case amongst yourselves. You did no investigation and you received no information. Is that all correct? Have you been approached by anyone since we last saw each other? And have you seen any media coverage? Okay. Mr. Anderson, your next witness, sir.
My name's called Maya Kowalski.
Do you solemnly swear or affirm the testimony you're about to give will be the truth, the whole truth, and nothing but the truth?
I do.
Please state your name for the record.
Maya Kowalski.
Maya, you have a very soft voice, so you'll need to get that microphone up there close so everybody can hear you. And where do you live?
I live in Venice, Florida, in a subdivision called Stonewalk.
And how old are you?
I am 17 years old.
Where were you born?
I was born in Elmhurst, Illinois.
Outside of Chicago?
Yes.
What kind of neighborhood?
It's a really small neighborhood. There was barely any houses. There was houses on both sides of the street, but only a single street.
And how were things growing up in your family? And we'll publish 2528-45 for this. Then you can continue. And we'll just...
Okay. So here I'm pictured with my dad's deputy chief fire helmet. You could tell I'm feeling pretty cool there. Growing up, Elmhurst was amazing. I loved it there, and it was like a quiet little place.
And did you get to spend some time with your dad and mom?
Both of them, yes.
They both worked?
Yes, they did, but they always made time for their children.
Did your dad ever take you to any fires?
He actually did take me to a few, but eventually he started dropping me off at my neighbor's house. The grandma was Polish, so Kyle and I could communicate with her pretty well.
Okay. And so during your time there in Elmhurst, did your mother or your dad introduce you to different hobbies and sports?
Yes, I was a ballerina at one point. I was a gymnast and then a figure skater. And then Kyle, he played soccer. He did piano. I also did piano. And then Kyle tried out gymnastics for a little bit.
Okay, let's show 2528-102. This is your mom and you ice skating. Was she your
Yes.
instructor at first?
At this point, no. My mom didn't teach me figure skating. She actually started after me. Here, we're in the Wizard of Oz production. I was a munchkin, and then my mom was a cowgirl.
Okay. And did you, let's go to 2528-115. how old were you when you were introduced to gymnastics?
I started gymnastics in Illinois. There was actually an incident on the playground. I approached a few girls and they were practicing their floor routine. And I asked if I could try. And they told me, no, you're too small. You'll never make it. So I went home. I told my mom, sign me up. She did. And I was actually really good at the sport from the beginning.
And you continued that through when you moved to Florida?
Yes.
Eventually? All right. And so were you able to spend some leisure time with just your mom? And we'll look at 2528-124. And by the way, so your mom didn't introduce you to gymnastics. You had the idea?
Yes, I did. Same with piano, and then ballet, all of them. They were all my ideas,
And your mom supported you in those?
always.
And that story you told, has that been indicative of your life when people tell you you can't do something?
Oh yeah, I'm gonna prove you wrong.
All right. So this is you and your mom now. Where is this? Is this once you reached Florida?
Yes, so this is actually Casperson Beach. It's the shark tooth capital of the world. There's a cute little restaurant there called Sharky's, and near it is this little pier, and after dinner, we would walk on the pier and watch the sunset.
Mm-hmm. Was that something you and your mom did regularly or
I-
tried to do?
Yeah, we did it quite often, actually, all of us as a family.
How was the transition from the suburbs of Chicago down here to the Venice area for you?
For me, it wasn't too bad. I did have my mom's family there and friends, but I was hopeful that I'd make new friends in Florida. And the idea of having a pool was really cool. So, I mean, that helped.
Mm-hmm. That was the inviting thing, the bait.
Yeah.
All right. When you moved to Florida and really during this period of time before the CRPS, can you tell the jury about your health generally?
Generally, it was really good. I mean, I did have asthma. I was diagnosed in Illinois, but it didn't bother me so much.
And just childhood illnesses for the most part?
Yeah, I did break my arm at one point.
So tell us about that.
Yeah, so in our subdivision, the road, it went up on a hill. So I rode up the hill and then I did like a little U-turn and I was going down, but there was a car behind me. I saw it, I freaked out, and I crashed into this curb, and then I fell into a ditch directly onto my arm and I broke it. After that happened, I didn't cry. I stood up, picked up my bike, dragged it out of the ditch, hopped right back on it, drove home, and I told my dad that my arm hurt, and he didn't think anything was wrong because I wasn't crying or acting, all dramatic. He told me to go lay down. I did. We didn't think much of it. A few days went by and I was holding it in a weird position, and my dad's like, "We should probably go get that checked out." So we went to the doctors. They ordered an x-ray. We went home. We got the call from the doctor that it was fractured. And only then did I cry because I realized I wasn't going to be able to do any of the activities that I enjoyed.
So how many days did you have a broken?
Okay, so what are we learning here? We're learning here that she's a pretty tough kid. She's a pretty tough kid. She was very active. She was involved with gymnastics. She was involved with ice skating. She played the piano, soccer. She was a very active child. And I've heard a lot of people in other chats accusing her of faking and making this up. And, this is what child is willingly going to give up those activities and make something? It just doesn't make sense what I'm seeing in other chats. So I'm not going to address any of that here because I just kind of think it's ridiculous. And when I heard some of the other testimony that we watched from Beatty and Smith saying that a 10-year-old child could, actually participate in the Munchausen's by doing this and faking the symptoms on purpose, it just made me really mad. Really mad. So please don't come in here and tell me that I'm biased or that you don't like my opinion or that you think that I should be more neutral. No, this is not a neutral channel. Just because I'm an attorney does not mean that I have to be neutral. And my opinions are going to shift based on the case. I say this every time. I am not a cupcake. That's my logo. I have a pink sign over here, which is right now blocked by the stream, that says, "You can't make everyone happy. You are not a cupcake." and I'm not a cupcake. I'm going to express my opinions. If you don't like that, you are free to change the channel. There are a lot of other people on YouTube who are covering this case, and you can go watch it there. And you can also just watch it on Law and Crime if you want to take part in a nasty chat. But I'm not going to tolerate that here, because this is a safe space for my viewers who suffer with these kinds of illnesses and who also have been falsely accused of Munchausen and had their parental rights stripped. And if you don't think that can happen to you, think again. Think again, because in Pinellas County, Florida, that is one of 6 counties in Florida where DCF is privatized, and outside contractors come in for a 10-minute interview to evaluate your child and just decide right then and there whether they think that there is medical child abuse happening, and can take you into court and take your parental rights away. So this case is way bigger than Maya and the Kowalski family, and this can happen to you. That's my position. I'm sticking to it. If you don't like it, please change the channel. You don't need to stop in the comments to tell me that you don't like my coverage, because I don't care. Quite frankly, I don't care. I don't care. Move on. Right now, we are going to move on. We saw a little bit. We got a little taste of what Maya is like. She's very bright. In my opinion, she comes across as very credible and a very likable witness. I'm going to fast forward. I'm going to fast forward a little bit so we can get where she talks about some pictures of herself in a wheelchair, or she's going to address them and talk about them. We're not going to watch the entire testimony. And if this is triggering for you, please feel free to take a break. Just hit pause, and when you come back, we will still be here and you can catch up.
If you could just tell them what happened, how you got there.
Yes, so my mom was an infusion nurse during this entire time. And while I was at Tampa General, Bonnie Rice, the nurse I told you about earlier, she had a phone conversation with my mom. And that's when Bonnie said that she thinks that I was making up my condition. My mom told her, no, there's no way. My mom listed all the symptoms I was having and said, how can she be faking these? My mom went back into the room to treat her patient, and he said, I'm sorry, I
respectfully object to the hearsay.
What did she say next?
Objection to hearsay.
Who said next?
What did strike it?
Some of the symptoms that she talks about, I know I can be loud when I can't turn up the trial audio. You know what? I'm going to try and speak a little bit more softly, because I know when I get passionate, I get loud. So what I will do is talk more softly. Just turn up your audio. There's no way for me to boost the volume on the trial audio. I understand it's a little bit quiet. So what you see in this picture is the symptoms that have already been discussed that are symptoms of CRPS. The dystonia, you can see how her feet are turned in. That is a symptom of CRPS. You can see that she's got sensitivity to light, so she's wearing sunglasses indoors. I don't know if you can see any of the lesions on her body right now, but she does testify, and the doctors do testify, that red lesions can appear on any part of the body at any time. And another thing about CRPS is that these symptoms can wax and wane from hour to hour, from day to day, from month to month. There are periods of time where she was ambulatory and could walk. There are other times where she was confined to a wheelchair. There are days that are better than others. And this is one of those diseases. And like I said before, this is the most painful disease known to man on the pain scale. It is no joke. It is often referred to as the unaliving disease. That is the nickname for CRPS. Used to be called RSD. Now it is referred to in the DSM as CRPS.
How did you know that Dr. Kirkpatrick might have some answers without telling us what somebody told you?
I know from the person who told us. I mean, that's how we found him.
Oh, sure.
So,
And
I mean,
who suggested it?
it was the patient of my mom, Dave, because he has a daughter with CRPS.
So a dad,
She's talking now about Dr. Kirkpatrick and how they were referred to him.
of another girl that had CRPS
Yes.
suggested.
Correct.
Now, so you went in and saw Dr. Kirkpatrick,
Yes.
and tell the jury what he did in order to determine what was going on.
He had a very lengthy examination of me, and it included multiple different tests. And he took all the data, and then he said that my symptoms and my condition aligns with CRPS.
Did he explain about the Budapest criteria?
He did.
And so what types of symptoms did you show in front of him, if you recall?
I believe he did a temperature test of my extremities. He noted certain lesions I had. You could see one on my right arm. And then I had extreme sensitivity to light. It's just with CRPS, the nerves are hypersensitive. I also had dystonia at the time. I believe at that appointment, there was no there was no signs of sweating, abnormal sweating. But again, that's just every day is different.
What's up with the sunglasses? Why the sunglasses?
I was sensitive to light, and that's just because the nerves in CRPS patients are hypersensitive.
Mm-hmm.
And then another, obviously, the big giveaway that I had CRPS was the burning pain.
And the feet turning in there, that's the dystonia he noted?
Yes.
Mm-hmm. And about how long did he have you over there to examine you?
It was quite a few hours. It wasn't like in and out like other doctors' offices.
And did Dr. Kirkpatrick keep you in the mix about what he was doing and why?
Yes, he always told me what he was going to be doing, the certain tests. He asked me if I was comfortable, uncomfortable. He listened to me.
All right. Now, this photograph is dated, I think, down there in the bottom left. It's October 5th, 2015. Had you seen him before this visit?
I'm not sure
September.
what day I saw him, but I know that he had an examination of me. And then the next time I went in, after trying pool therapy, we tried out the ketamine infusion.
Okay. So, important to know, did Dr. K immediately go to ketamine, or did he have another therapy he thought might work?
No, he wanted me to try the non-medicated route first, which we did.
Mm-hmm. And what was that non-medicated route?
It was warm water therapy. My dad had bought a system to heat our pool. So I think like 10 out of 12 months of the year it's warm.
Mm-hmm.
So I was able to practice my therapy in there and try to gain some strength.
And did you try hard at that?
Yes.
How'd it do?
It helped a little bit, but it was not the improvement that Dr. Kirkpatrick was hoping for, or any of us were hoping for. So he decided it would be best to try the ketamine infusion.
In terms of physical therapy now, well, let's talk about what you had already been through at the different places at Tampa General and so forth. Had you had physical therapy so far? By this
Yes.
point? Had you had, I guess, occupational therapy, upper body stuff?
Yes.
And had you had some psychological evaluations?
Yes, I had
interviews?
counseling. Mhm.
And did you then have warm water therapy?
Yes.
And what kind of meds had they put you on up to this point of the ketamine? What were you taking?
I'm going to be honest. I was, again, like really young, so I didn't ask what medication I was taking. But it's my understanding I did try some prescribed opioids from my doctors.
Remember anything about whether they worked or not?
They didn't.
All right.
So this testimony is important because it shows that they tried a lot of other more conservative measures to treat her condition and her pain prior to jumping into K therapy and the K coma that she went to Mexico for. And it's also important to note, and she'll testify about this later, that a lot of people are under the misimpression that she was being given K infusions at home by her mom, and that is not true. She was given oral K, which is different, far different dosages, and everything that people are saying is untrue about her getting the infusions at home. Also important to note is that when she was admitted to Johns Hopkins, they had her working diagnosis as CRPS. She had been there before. They had also installed a port in her body for these infusions that she was receiving from Dr. Hannah. So this should have come as no surprise that when she came into the ER the night of the hurricane, which is the subject of this lawsuit and the subsequent stay, that she already had a working diagnosis of CRPS. Keep that in mind.
So you'd been through physical therapy, occupational therapy, psychotherapy, warm water therapy, opioids. Now you were trying ketamine.
Yes.
Tell the jury how that went.
The ketamine infusion.
Yes.
So
Have we put in 252942? Is that already up?
That's the K word. If you were wondering what the K word is, they just said it twice.
All right. Go ahead and explain what.
So the ketamine infusions were very different than anything I had tried previously. It's this like really small room with a bunch of different equipment and then a nice soft bed. And then super adjacent to the bed is like a little TV so the patients can watch whatever they want while they're getting the infusion. I slept for most of it, so I don't really know the duration of the whole treatment, but I know it was over the course of a few days.
Well, you said you slept during most of it. How are you sleeping at night at this point?
Oh, I was not sleeping. It's very difficult to sleep when, you're having excruciating pain and pain that you've never felt before.
And so, even with your high pain tolerance, describe for the jury as best you can so they can understand what it's like, the CRPS pain.
How I describe it to people who don't have CRPS, it's like I was born with gasoline deep within my body, and some incident, whether it was that sprained ankle or the severe asthma attack, was like a match and acted as a catalyst that just set my body on fire, and I have to live with this burning pain.
All right. And
That's her description of the pain. Think a 10-year-old child will be able to make up that description of her pain? I don't think so.
So, how many of these, strike that, during the time at TGH, did you also have
Oops.
physical appliances applied to your legs and ankles to see if.
Let's try that again.
Oh, I was not sleeping. It's very difficult to sleep when, you're having excruciating pain and pain that you've never felt before.
And so, even with your high pain tolerance, describe for the jury as best you can so they can understand what it's like, the CRPS pain.
How I describe it to people who don't have CRPS, it's like I was born with gasoline deep within my body, and some incident, whether it was that sprained ankle or the severe asthma attack, was like a match and acted as a catalyst that just set my body on fire, and I have to live with this burning pain.
All right. And so, how many of these, strike that, during the time at TGH, did you also have physical appliances applied to your legs and ankles to see if that would straighten out some of your symptoms?
Unfortunately, yes.
tell the jury about those in addition to physical therapy, occupational therapy, psychotherapy, warm water therapy, opioids.
So with CRPS, you have to be very careful with the type of therapies that you provide. And with physical therapy, you have to be especially gentle. Now, I was put into an intensive physical therapy program. And again, at the time, we didn't know I had CRPS. So we didn't know that it was actually doing more damage than good. One of the doctors noticed that my dystonia was getting extremely severe as my stay went on. He suggested that he breaks my feet, have a corrective surgery to straighten them out.
Let's publish 2529-35.
She's referring right now to a previous inpatient stay that she had at Tampa General Hospital. This is not the Johns Hopkins admission yet.
And that was Dr. Kornberg. I remember his name.
All right, so are those the corrective boots you wore?
Yes, so this was like part one of his plan. He wanted to see if the boots would straighten my feet out, and if it didn't, he was going to resort immediately to surgery.
Now, I can't quite see your mouth there, but what are you feeling there in that facial gesture?
Forcing my feet to immediately go from, completely turned in to straight was an awful idea. It was extremely painful. I remember just crying and crying.
And did your mom want you to try it though?
She did. She knew it was hurting me, but again, at the time, we didn't know what was going on, so she was just listening to the doctors.
So the jury knows, did your mom ever push you to do any of these treatments? Or was this something that you wanted to try too?
I also wanted to try it because I had my trust invested in the doctors. I thought they knew what they were doing.
Through this entire period of time, were you ever pushed by your parents to continue a therapy that wasn't beneficial, or strike that? Were you ever pressured to do any types of therapies or things that maybe you already knew didn't work?
No, if we figured out that it didn't work, they were okay with listening to me and not going on with it.
Okay. So how many of the ketamine therapies do you recall having for this with Dr. K?
So after Tampa General, I had, I believe, one, like not like a single treatment, but because it spanned over a couple of days, but itself, it was just like one session, if that makes sense.
Okay. Now, at this point, if you can recall, I think we have a video. I don't know if we'll see it, but can you show the jury about how high you could raise your arm going into all of this? Can you
So-
demonstrate about how high you could get it?
Yeah, at Dr. K's, I believe I told you about the examination, and part of his examination was like a physical, like range of motion examination. I was only able to lift my hand to about ear level, nothing past that because of the pain.
All right. And so then after that, how did the ketamine therapies do for you? The ones at Dr. K's?
At Dr. Kirkpatrick's office, the ketamine definitely helped. It had helped me more than any of the previous therapies I've tried. So I wanted to stick with that in addition to trying the warm water therapy and continuing going to counseling. But ultimately, Kirkpatrick noticed that his treatments weren't going to get me to where he wanted me to be. So he brought on another doctor.
Okay. And were you continuing the warm water therapies when you were doing the ketamine?
Yes.
How did the ketamine affect your ability to do physical therapy?
Well, obviously, I couldn't do it like immediately after. It's a new drug, and I did have some side effects. I was a little bit confused coming out of it, but the confusion doesn't last long. By the end of the day, I was talking in my normal self.
But could you do more warm water physical therapy using the ketamine as without it?
Yes.
And why was that?
It's just because it alleviates my pain. For the first time, something is actually helping lower that burning pain. So I wanted to try even harder in physical therapy.
How did it feel finally having a diagnosis that made sense?
Obviously, the diagnosis itself isn't great, but it's nice knowing what it is so you can develop a course of action to try to tackle it.
Did your mom, best of what you remember, start researching what CRPS was?
Yes, so my mom, she was an infusion nurse and she's pretty familiar in the medical field. So naturally, she wanted to learn all about it herself.
In terms of the medical analysis, if you will, for you, between your mom and dad, who would take the lead?
My mom did because that was her field of expertise.
Okay. So your mom was kind of your home physician or home nurse,
Sure, yeah.
and she was teaching you Polish.
hmm
And would she take you to different events and places, drive you places?
Yes,
And was she helping you with your piano?
yes,
And was she helping you through ballet?
yes,
Okay. Did you have a good relationship with your mom through this?
yes, I always did.
How about the fact that she wanted you to try some of these therapies that were hurting you? Did that harm the relationship? Or
No, it didn't because again, you have to remember before we went to Dr. Kirkpatrick, we didn't know what it was. So I think her willingness to try everything was actually a sign of love.
how did your dad react to finally hearing that this was CRPS? I mean, it's mixed.
I mean, no parent wants their kid to have like a chronic illness. So they were sad, but I think at the same time, they were just happy to hear a definite answer.
And how did they react to you telling them that after these ketamine infusions that it helped?
They were so happy to know that, something was helping. Finally, like one thing we try is actually doing something for me.
Anybody ever have a child who is suffering with constant horrific pain? There's nothing worse. I have 5 children. Nothing worse than seeing one of your children in pain and constant chronic pain. You would do anything to take your child's pain away. Imagine the relief they felt when they finally had an answer, when they finally had a diagnosis. There's been testimony that Maya would scream all night in pain and that the parents would have to take turns sleeping on the other side of the house just so that they could get some sleep because of this child's tremendous, constant pain. It's heartbreaking.
And up to this point, when could they do anything for you when you would have, when the pain would be at its worst? Was there anything they could give you or do for you that would affect it?
Before this, no, not at all. I mean, I remember laying in bed and just crying and crying. And I have this memory of my dad. He took my monkey. You'll probably see it in a bunch of pictures, but he would take the hand of the monkey and rub it on my forehead until I fell asleep.
And were you sleeping? Tell us the sleeping arrangement once this got really bad.
Once my pain was to the point where I was just crying and screaming throughout the entire night, the way our house is arranged, first off, is I'm on the opposite side of the house, and then there's my brother's room right across from mine, and then the other side is my parents' room. So I couldn't walk to go and tell them when I needed help going to use the restroom. So we implemented a walkie-talkie system. It sounds silly, but I didn't have a phone at the time. So I would talk back and forth to them so they could help me in the middle of the night.
Could you tell how it was affecting your folks that their little girl was moaning all night in pain?
I try to keep it in as much as possible because
Did
like
they appear to
seeing
be
that
under some
face.
stress?
Yeah, they were definitely stressed out. And
How about Kyle?
oh, for sure. I mean, we used to play together all the time.
Were you and your brother close?
Yes, we were. Even when we were really little, we had a very good relationship.
It's like you're the big sister.
Yeah.
Okay. How far apart are you two?
We are 18 months.
All right.
And then we do have an older sister as well.
That's right, Corrine.
Yes.
How much older is she?
I think she's 16 years older than me.
Okay. And were you close? Are you close with her?
Yes.
How was Kyle reacting to hearing his big sister in this kind of pain?
Well, my parents tried to keep him out of the loop when we didn't know what it was because you don't want to worry your other child as well. But obviously, he knew something was wrong. I wasn't walking, I wasn't playing, I wasn't laughing as much. I didn't go outside because I couldn't. So I believe he tried his best to distract himself with the neighborhood kids playing football and whatnot. But he was heartbroken.
Yeah. And so for you, was it difficult to see the other kids outside playing and you in the wheelchair?
Yes, very much so. There's actually one day I was invited to the YMCA, which is where I used to do gymnastics. And I was wheelchair bound at the time. And I never went back to watch them because it just ate me up.
Do you want to get out of that wheelchair?
Yes.
All right. So now,
Okay, so we've seen a little bit of Maya's initial testimony. This goes on for at least another half an hour on this first tape, the first day I think that she testified. And I'm not sure if Fox 13 broke this up into 2 tapes, but what I'd like to do is skip ahead now a bit. And I suggest that you, if you are interested in this, that you go back and watch the remainder of that portion of her testimony. It's hard to watch a lot of this at once. So let's go to the chat for a couple minutes. Oh, thank you, Michelle, for becoming a new member. I appreciate you. Allison, so good to see you. Thanks for coming a new member. Tim, there is trial. I believe it's starting at 3:30, and I think it's jury instructions today. There's so many moving parts to this trial that things keep changing and shifting, but that's why I thought today would be a good day to do this because there's no live testimony, and I know a lot of you like to watch it live. Carmen says, honestly, I feel like I didn't give Anderson enough credit before. He really doesn't let go when he knows he has a point. Yes, and I've discussed this before too, that when you're on trial on a case like this that is so complex and has so many moving parts, and you constantly have objections being sustained, and then you have to pivot and try and rephrase your question and get your evidence in another way, and your brain is moving in so many directions that sometimes you don't really get to see how amazing an attorney is in every single part of the trial. And imagine you also have cameras on you. You've got a million exhibits that you need to juggle. You've got somebody who's got to pull them up for you. And he, for the most part, has been trying this case pretty much. He's been lead on this case. He pretty much hasn't sat down this entire case. Maybe there's been another attorney from his office that has questioned a witness or two. But for the most part, he's been the face of this case. And this is a tremendous amount of work. And we saw in the deposition testimony that we watched some of his incredible questioning that I pointed out to you. Thank you, Jesse, for becoming a member. I appreciate you. Carmen, yes, this goes back to what we were saying before about this case is not just about Maya. It's much bigger than Maya. No, that is not the comment that I was talking about, but this is a good comment as well. Also, this is a civil trial. There's no innocent until proven guilty. They can find against the hospital with 51% leaning one side, right? In a criminal trial, you need to prove your case beyond a shadow of a doubt. So it's got to be, if these are the scales of justice, it's got to be like this. In a civil case, it just has to tilt a little bit to one side. It's just a preponderance of the evidence, not beyond a reasonable doubt. Congratulations to everyone that I gifted memberships to. And thank you to New Hampshire Woman for becoming a member. Kay Sango, sitting here and thinking about this broken arm, if it really was Munchausen, why didn't the mom milk that and hospitalize her then? This family reacted totally normally. I think so too. I don't know. It just seems obvious to me, but I think there's a lot of people who completely feel the opposite way. Yes, I agree with you, Cat Lady. This trial could theoretically help chronic pain patients, even if it's stuck in appeals. Correct. We don't know what's going to happen. Depending on the amount of the verdict, if there is a verdict, if they find in favor of the plaintiff, if it's what the defense considers to be an excessive amount, they could appeal the number. They could appeal the decision or the verdict. And during the pendency of an appeal, many cases settle. So, it doesn't necessarily mean that the case would be tied up for appeals for years, but it's possible. Oh, you're very welcome, Cheryl. Cat Lady, thank you for becoming a member. And DK, thank you for becoming a member. I know that you guys are always around and always participating and always in the chat. So what I'd like to do now is skip to the next portion of her testimony that I had flagged, which, let me see when this is, which I just closed the window of. So we need to get back to that window. Give me 1 second. Talks amongst yourselves for 1 second. At least I'm getting better at closing my windows, you guys, because I was keeping my too many windows open and it was not really working out for me. Mhm. All right, I found it. 1 second. Today's the day that every loud truck is deciding to go by my window. I don't know if you can hear them on your end or not, but it's crazy. Okay, so we're going to listen to Maya talk about. No, that's the wrong tape. Sorry. Did anybody watch the testimony from yesterday? The defense testimony of, what was her name? Her name was Tori Niehaus. Anybody watch that? Tell me what you thought about that and if you think that we should look at that together, because that was crazy. Okay, this is the second part of Maya's testimony. All right, here we go.
And Ms. Kowalski, you understand you're still under oath?
May it please the court.
You may inquire.
Ma'am, when we left, we were right up to the point of the infamous October 7th admission. I want you to tell the jury at this point in the midst of your relapse, your first relapse, what symptoms you had.
I had the same burning pain, but this time it was more amplified than it was when I was getting the infusions. And I had lesions coming back. I had discoloration and change in temperatures. And my dystonia was more
Obviously,
prevalent.
it's-
Sorry, forgot.
And you were obviously in a wheelchair.
Still in a wheelchair.
Now, before October 7th, were you still, had you had this problem in the gut with being able to pass food through because of the CRPS?
That was a problem that was more with my CRPS, yes, constipation.
Hmm. Okay. And had you been to Johns Hopkins the week before, October 1st, to visit?
Yes,
And what was that for? Was it for the same thing, the stomach issues,
Yes.
the lower stomach issues? Okay. Um, and at this point, you were what, 10 years old?
I was 10.
So let's talk a little bit about that visit. So, do you remember the why of going there that day, that morning,
October 7th?
the 7th?
Okay. Yes, so I was in excruciating pain, and this time my stomach was also like, it was awful. I was complaining, my knees were up to my chest, I was crying. So my dad took me in.
All right. So it was your father, not your
Yes.
mother, that took you in?
And then the week prior, my dad also took me in.
Mhm. Tell me something. When you would go back to Johns Hopkins or and any of the doctors there, were they immediately aware of the history, or did your dad or mom have to explain it every time, your history?
Speculation. Overall.
Actually, yeah, my parents always had to re-explain my history of CRPS.
From what you saw, was this frustrating for your family, to your mom and dad, to have to explain the same thing every time you come in?
Most definitely.
All right. So, um, so you come in and your dad gives the summary of, or describes your history. What do you recall after that?
I remember just being in the ER, but I wasn't in the ER for too long. I remember I was transferred to the PICU.
All right. And up to that point, while you're in the ER and up to the certain event, were you in pain? Were you calm? Were you active? What was your outward manifest?
I was actively in pain, yes.
Were you thrashing or acting out in any way at that point?
At that point, no.
So they took you up to the PICU, and tell the jury what happened then.
When I was transferred to the PICU, I
For those of you who are not familiar, the PICU is the pediatric ICU.
remember my mom came in at some point. The nurses and doctors wanted to put a tube down my nose. And with CRPS, I mean, a blood pressure cuff, that hurts. So imagine, like a tube being shoved down your nose into your stomach. And obviously, that would have caused so much pain. And I knew my body, I knew I was not going to be able to tolerate that. That is the only time I asked for sedation. I didn't just randomly yell out, I need sedation, like depicted in the medical records. I only asked for sedation when they wanted to do that procedure.
And then, were you given sedation before they tried to put this tube down your nose?
I was not. And my mom was actually in the room, and she listened to the doctors and didn't demand for sedation. Instead, about I would say 2 or 3 people held me down and tried to get the tube down my nose. That is when I was screaming, crying, and thrashing around. I did not curse at any of the staff. That is a lie. But they were not able to get it down, which I suspected because of the pain.
Were you fairly religious? Did you curse as a matter of course as a religious 10-year-old?
I never really cursed. I mean, I always thought it was really bad when people did it.
Okay. Later on, you heard that in the hospital, though, from others. But
Yes, from
we'll talk
staff.
about that. We'll talk about that in a moment. Now, they tried to do this, and so how did it feel when the doctors or nurses, I guess, held you down? Describe it in more detail. Where did they grab you, and how hard they grabbed you, so forth?
Well, it was It was just like the upper body portion because they were trying to get the tube in my nose. So they were holding on my shoulders and just like my chest area. But again, they were not able to do it. Ultimately, they had to use sedation.
Okay. And I want to ask something right now. Maya, do you have a symptom that while you're up here, you might manifest known as myoclonic jerking?
Yeah, so I don't know if people have noticed this, but normally when I'm sitting in the courtroom and whatnot, I have these like little twitches. It could be anywhere from, my feet to the head. They're kind of random. I'm not doing it on purpose. It's just a symptom of CRPS and it's involuntary. And because I'm not getting my infusions at this point in time, unfortunately, they're going to be getting worse and worse.
Okay. So now you're being held down and you got sedation. What do you recall after that?
Well, I do remember the tube being in my nose. I remember my mom having to leave on a certain day, and this was the last time I talked to her.
Okay. Now, and before I forget, there was, I'm sorry I'm jumping around a little bit. I'll make sure I get to this. Before we go on, by this point, did you know what having a ketamine infusion, the feeling of ketamine inside you was?
Yes.
Were you able to tell throughout this period and after you had started having them with Dr. Kirkpatrick and Dr. Cantu and Dr. Hannah, were you able to tell when your body was receiving ketamine?
Yes.
And how could you tell?
I could tell because the pain level, first off, it was lowered, and there's like a feeling. It's like, I don't know how to explain it, but you could just tell, like, you feel a little bit funny. It's not your normal self.
Okay. And then tell the jury whether, the best of your knowledge and for everything you saw, heard, felt, your mom ever gave you IV ketamine at home.
Never through the IV, no.
How did she give it to you?
It was orally administered, which was okay by the doctor and everything. It tasted a little bit weird, so at one point I asked her to add Gatorade to it, so it's just easier to go down.
But the prescription itself, and if you're aware, great. If you're not, it's okay. The prescription itself, what did it read? Did it say oral? Or did it say intravenous? Did it say?
The bottle itself?
Yes.
Yeah, it said intravenous, but it was only for oral purposes.
So you apply it out of the bottle to the Gatorade.
Right. Never through the IV.
You never had an IV ketamine at home?
Not at home, no.
All right. So now sorry to jump around. You're back in the hospital, and did they start to examine you? And if so, what happened after that, if you recall? Or do you recall much after you were sedated would be a better question.
No, but I do remember being in the PICU.
All right. And was there anything else that you recall? Was it just one nurse coming in and out, or were there more people there?
In the PICU, you mean?
Yes.
Yeah, I
Yes.
remember, well, because I couldn't walk or anything, I had to have help using the bathroom. And I remember, it's quite embarrassing, but my dad was helping me clean up, and a doctor came in, or so I thought, a doctor, because I knew it looked like a doctor because all of them wear this like white lab coat, and then there's colored squares across their chest. Usually there's like a name embroidered in, but I didn't see that on her. So I assumed she was a doctor. She came in very briefly, and it was awkward because here I am, naked from the bottom down after using the restroom, and she's asking my dad questions, and then she left the room.
And did you subsequently find out who that was?
Later, I found out it was Sally Smith.
Okay, so that's her testimony on Sally Smith. There's been a lot of chatter about whether or not Sally Smith was wearing a Johns Hopkins lab coat. There have been some other YouTubers that have found what may or may not be an old picture of her wearing a Johns Hopkins lab coat. She testified that she never owned a Johns Hopkins lab coat. And her choice of words, Sally Smith, is very telling to me, because there may have just been a rack when you walk in the hospital of lab coats that doctors could put on. I do not think that any doctor, and if there's doctors in the chat, you can certainly chime in here. but I don't think any doctor in a children's hospital would walk around in casual street clothes. And it is irrelevant. Correct, Amber, you beat me to it. It is irrelevant because she did wear a Johns Hopkins badge and she did admit to that. So holding herself out as being part of the hospital is another question in this case. I know that Suncoast and Sally Smith settled the case against them personally for $2.5 million. I think in 2021, don't quote me on that. So they were discontinued against, but the question that remains is whether or not the hospital is vicariously liable for some of Sally Smith's actions because she was holding herself out as a doctor at the hospital. Yeah, and somebody also said that wasn't the same Sally Smith in the picture, and that's why I'm not even going to show it. But what we're just listening to right now is Maya's testimony that she did have this particular lab coat on when Maya did meet her this time in the hospital.
Did anyone from the hospital differentiate Sally Smith from any of the other doctors that you were seeing that day?
Absolutely not.
Did Dr. Smith explain her role in any way?
Never.
And did she question your dad? And I don't know about you, but did she question you or your dad about symptoms and history?
She actually believing Your Honor. Overall.
No, I do not recall that.
Now, after Dr. Smith, then, was your mom telling the doctors? Do you recall who was in there at that time, the doctor-wise? If you don't, it's
I don't know their names, sorry.
Man, female, male.
It was usually more than one, but sometimes they came in individually, and it was mixed gender.
All right. And so was your mom explaining the symptoms? And
She always did. I mean, that was pretty routine. She had to do that for almost every visit.
was your mom worried from what you could tell or excited? How would you describe her?
Well, she was definitely worried about her kid, and we had just moved to Florida, and I don't know if you know, but there was a hurricane during this time, so I think everyone was kind of on edge.
Did you learn at that time or subsequently why you went to Johns Hopkins as opposed to other hospitals? Or, well, there was a Johns Hopkins in Sarasota, wasn't there?
I don't know, but it was a distance thing. We were staying at the Ronald McDonald House.
Oh, okay.
Because at the time it was easier to get to my infusion place with Dr. Hannah rather than driving from Venice to wherever he was located. And it just so happened that the Ronald McDonald House is very close to Johns Hopkins All Children's Hospital.
So you were on campus, in other words, at Johns Hopkins.
Yeah, pretty close.
All right. And so your mom told them about the symptoms. Do you recall them questioning you at all about your symptoms?
No.
So what happened after that, to the best of your knowledge? Did you stay up, go to sleep? What?
Well, like I said, there wasn't ever a specific time where I saw the doctors and nurses ask my mom to leave. It was only because this was the day that she had to go to work, and that was my last conversation with her. Whereas with my dad, I vividly remember people coming in and telling him that this was his last time to say goodbye to me.
So was this the last time you saw your mom?
The last time I saw my mom, my dad wasn't there. I was laying in the bed.
This was while you're in your room. Did you
Still in the PICU.
Still in the PICU?
Still in the PICU, yes.
So this is pretty close to when you checked in? Or
Yes,
got admitted?
yes. I know I was still in the PICU. My mom was like picking up her work bag and just like little things she had brought to the hospital. And she said, "I love you and I'll see you tomorrow." And I never saw her again.
Need some water? I noticed you're wearing a necklace. Why don't you explain that?
Yeah, so December 10th was my birthday.
Trigger warning. This is very upsetting, and thank you, Paul, for your super sticker. And I totally understand why you might need to take a break from this, but I do appreciate you. It is painful to watch, and that's why I'm going to skip around, because If you don't have tissues, guys, you may want to get some tissues. I'm going to play a little bit more of this portion of the testimony, and then we're going to skip to some other portions. It's a lot. I know it's a lot.
I turned 11 and I was unfortunately still in the hospital at the time. And the hospital has this program where they collect funds for children who are still in the hospital on their birthday. I was given $20 to spend. And I remember the social worker came in and she asked me what I'd like to buy. I bought a Nerf gun for my brother. I bought my mom a necklace, and then I bought my dad his favorite bag of mints because I didn't have a lot of money left over. But then my Aunt Wendy bought him this little glass Christmas tree, and we just said it was for me. But I bought my mom this very specific necklace that says "I love you" to the moon and back. It's just like she always said that to me. And then I found out later that she wore it every single day. And when she was found in the garage, she was still wearing it. And I have it on my neck right now.
Have some water.
Sorry.
We'll get through it. Can we publish 2571-001? We're going to switch for a second there, Molly, and ask you about obvious symptoms at the time of your admission.
Okay, we're going to skip forward a little bit. I love you to the moon and back. Anybody who knows what that's from, it's from, I think it's from Goodnight Moon, the children's book. I say that to my kids all the time too, but this is heart-wrenching. And I watched this portion of the testimony and I just thought to myself, do they have their checkbook out? Because maybe they should just write a blank check. I don't know. Tell me what you think in the comments. I know you will. I'm going to skip forward a little bit.
The social worker, Kathy Beatty, said that my mom was in a mental institution, making me think that something was wrong with her. And I asked my dad, and it turned out to be a lie. So they were trying to even manipulate me into thinking that my mom was sick and therefore making me sick, even though it wasn't true.
Can you imagine this? Can you imagine this? Kathy Beatty, the hospital social worker, is telling Maya that the reason her mother is not visiting her is because she's in a mental institution. I'm going to rewind that because I think it's so important that we are going to listen to this again. There is no amount of money. There's no amount of money that can undo what happened to this family. But if this just makes one hospital change their internal policies and procedures, everything that she's going through, no, I don't even know that I can say would be worth it. I don't even know that I can say that.
Making me think that something was wrong with her. And I asked my dad, and it turned out to be a lie. So they were trying to even manipulate me into thinking that my mom was sick and therefore making me sick, even though it wasn't true.
Well, as the allegations of Munchausen by proxy, which are that your mom or dad are intentionally trying to keep you sick, did any of the doctors or nurses ever simply ask you about your relationship with your mom and dad?
No, and as a matter of fact, they always told me what went down in my house. Dr. Elliott, he said that my mom was putting me in a coma every single week, and I told him no. But even though I told him no, he wouldn't accept that as an answer.
Did they seem to have their own story they wanted told?
Absolutely, no doubt about that.
And so then it says a patient has a right to refuse any treatment. Were you ever given any right to accept or?
Okay, this is the Patient Bill of Rights. I'm just going to read quickly to you the portions that he highlighted, or actually I'm just going to stop here and you can come back to this later and read the Patient Bill of Rights. And this is what patients are entitled to under the law and or the hospital procedures. And we're going to fast forward a little bit to some things that speak to the false imprisonment claim.
Remember that happening regularly. There was a lot of PT though.
Now, do you remember a time when you were put into a room and told you could not leave for some reason?
Are you referring to the
48 hours?
Yes. Yes, I was told about that.
Tell the jury what happened then.
So I was told it was for like a EKG, and I don't know what that is. So I just said, okay. I know now what an EKG is, and what happened in the room was nothing like an EKG. They left me there for 48 hours under surveillance, which they did not tell me about. They had a commode in there, and they just put it far enough away from the bed so I would have to physically stand up and use the bathroom. I called the nurses whenever I had to use the bathroom because obviously I'm not able to walk. And when they refused to help me go to the bathroom, I would defecate on myself.
So let's show 2703-B, a clip from the covert surveillance.
That's her brother Kyle and her dad.
Do you know you're being recorded through all this?
No, they never told me.
Continue. Is that it? Is that the end of it? Okay. Now, so you had to have help.
Yes.
And was there any way to reach that commode to relieve yourself without help?
No. Not in my condition.
And what would the nurses do when they came in and you had messed your bed?
They would be pretty angry. I had this one nurse, I would call her whenever I had used the bathroom, and I'm understanding that you have other patients. I get that. She would come into the room, and I'm not even joking. She would yell, 10 more minutes, and then she would storm off. But again, my door's open, the blinds are open. I could see her conversing with the nurses. They have these like little council like areas, and I could see her talking. She was not busy. So I genuinely believe that they just wanted to push me to the limit of like, oh, I'm about to pee myself. I have to get up and stand. But that never happened. Instead, I just peed on myself.
And you were not allowed to leave this room for 42
No,
to 48 hours?
No.
And you would have left if you could?
I wish I could have.
So they kept you in there against your will?
Correct.
All right, let's use.
Imagine telling a 10-year-old girl, 10 more minutes, I'll let you use the bathroom. You're going to need to wait because they were trying to catch her in some sort of charade by videotaping her for the 48 hours she was in this room. I don't know. Is anybody else horrified?
Let's take a look at 21-116, a series of text messages at or around this time regarding this particular visit. And if we could move to.
Judge, again, we object to foundation and through this witness, these are not her text messages.
Overruled. You may proceed.
This next page. I'll get you highlight and get to the part and highlight it with the description. All right, there you go. There you go. Can we, yes, it's 005 we're on right now. So this is with Dr. Dees and Dr. Sal.
Okay, these are text messages between the doctors. This is Dr. Dees texting Sally Smith And I'm watching it on my screen over here because I have a giant screen over here for those of you who are going to comment. You're squinting. Can you believe the mean things that people say to me? I can't. But anyway, the text from Dr. Dees to Dr. Sally Smith says, FYI, I just went to see Maya. I watched her use her feet to push herself several feet in her wheelchair in her room. My son was outside the room and I was trying to prevent him from coming in the room, and she wanted to see him, so she inadvertently started coming towards the door. She was distracted, and I'm not even sure she realized she did it because I didn't call attention to it, but I mentioned it to the nurse who also saw it earlier too.
Sally Smith. Now, it says here something about pushing several feet in your wheelchair. Does CRPS involve paralysis?
No, it does not. There are some patients with pain so severe that they might not be able to move their limb. But that wasn't the case for me. I was still able to move my limbs. Obviously, I had my days, but I've never had paralysis. That's not associated with CRPS at all.
But that's what they were concentrating on, was whether you could move around or not?
Right. So even though I explained to them that the symptoms vary, that's just the nature of CRPS. For some reason, they couldn't understand that.
Here's a 10-year-old girl explaining to the doctors in the hospital what the symptoms of CRPS was.
All right, so I think there's another one here from Dr. Smith replying to this. Yeah, what's that? It talks here about you being 10 and not being able to.
Okay, they don't read the text messages into the record, so if you're listening to this, or even if you're not, and this is very, very small font, I'm going to read this to you. This is the same day, which was November 6th of 2016. This is now a response from Sally Smith, Dr. Sally Smith, the child abuse pediatrician, who is with the outside contractor Suncoast, who may or may not have been holding her out as a staff member at Johns Hopkins. Texted to Paula Dees, who actually is a doctor at Johns Hopkins. Fortunately, at 10 years old, she can't perform the charade effectively 24/7 and doesn't even know if she's making, quote, physiological mistakes. I'm coming to take some pictures of her, quote, affected legs for court on Tuesday.
Perform this charade effectively. Were you keeping up a charade, Maya?
Not at all.
And did anyone ever come into you, thinking back to the patient's rights, and explain to you that they were concerned that you were making all this up?
No, they never told me that, but they did tell me frequently that I was all in my head. So they just planted the idea there instead of questioning me about it.
Now, and at 10 years old, I know you're very intelligent for a 10-year-old, but were you equipped to try to outsmart or outthink or whatever these doctors at this point?
I would do that to a doctor. I had an illness and that's what it was.
Thank you. All right.
Cassandra, thank you for being a channel member. I don't know how they could treat a child like
Now,
this. I
there was
wonder
a
the same things.
part of I forgot an event here. So I have Nick. So it talks here in your rights about being able to have another doctor or specialist outside the hospital see you. Was there an attempt, to the best of your knowledge, to have Dr. Hannah come see you
In December?
at any time?
I don't remember that. I know eventually down the line I was able to see him, but I was not made aware of any attempt for him to come to the hospital.
Okay, so this was outside the hospital when you saw him.
Correct.
So during your time in the hospital, was any doctor outside of Johns Hopkins allowed to come in and examine you?
No.
Okay, now, I want to pull up 2703-A and ask you, were your CRPS lesions prominent by this point?
Yes,
And did you from time to time ask the nurses to give you something to help them?
I did. I was without my special lotion that I was prescribed back at home with the lesions. And here I just requested Aquaphor because I believed it was the next best thing.
I look at this adorable little girl. How could anybody be mean to her in the hospital? I just don't get it.
Yeah, here I'm showing where all my lesions are.
How, if you know, let's get finished with it here. Keep going.
So CRPS can also manifest itself in lesions, and Sarah and others in the chat with CRPS can explain that better to you probably than I can. But there will be some evidence later, and we've also heard from Kathy Beatty, who said she was taking photographs of Maya to bring to court because she thought that some of these marks on Maya were self-inflicted. And Maya goes into great detail about her lesions and what they look like and how they can look like scratches. And I'm going to skip a little bit forward to her interactions with Kathy Beatty, who you may recall was the social worker at the hospital, employed by the hospital.
Yes, so there's this whole ordeal with Kathy assuming that I was emailing
I don't know if they'll read this into the record, so I'm going to read it to you. It's a text message on October 19th. So this predates the ones we just looked at of 2016 from Sally Smith to Dr. Dees saying, we may need to try to monitor what she's doing online. I wouldn't put anything past her mother.
my mom. So my teacher, Jackie Dieter, she came over to the hospital and I was given a laptop for school purposes exclusively. And most people don't know this, but with the school email, so I only had a school email, which is like your N number, which is what you use to log in, and then it's whatever school county you're at .net. So I could only send emails to people within the school district. That meant teachers and students. That is it. I could not receive any external emails. As a matter of fact, the whole system itself blocks external emails, and you cannot send external like emails to people outside of the system. Again, it blocks it. It will not let you. So there was this nurse who was in my room when I was on my computer trying to do homework and school, and she noticed that I was on the email portion of the platform. She immediately went, grabbed Kathy, told Kathy I was probably trying to contact my mom. Kathy came back into the room. She said that I can no longer have my computer because she was in fear that I was browsing sex websites.
Did you know what a sex website was at 10 years old?
I didn't even know what sex was.
Apparently she was introducing this concept.
Yes.
Full stop. Full stop. Kathy Beatty said to her, you cannot have a computer because I think that you are surfing the internet for sex websites. She's 10.
So let's talk about your relationship with Kathy Beatty. Was she there on just one floor so that if you switch from one floor to the next floor, you got somebody new?
So it's pretty like standard practice that whenever you move floors, there's like a social worker per floor. But weirdly enough, Kathy Beatty literally followed me wherever I went.
So from the time assigned to the end, she was there.
Yes.
Okay. And how would you describe her interest in you? Was it the normal interest of a nurse or social worker, or was it something? What, if anything, was unusual about Kathy Beatty's approach to you?
Overall.
I have a lot of stories about Kathy Beatty, so it's going to take some time to go through them all. but there was the whole chapel incident where a nurse wheeled me down to the first floor where the chapel is located. The nurse left when Kathy Beatty approached me. Kathy Beatty then kissed me, said, "I'm not trying to be your mother, but I can be." Then she wheeled me into the chapel. And at this point, I was so excited to finally be able to go to the chapel. And she just destroyed all of my excitement. She picks me up, puts me on her lap. She sits in this tan chair at the back of the chapel. There's a photo of that. And she just sat with me there. And then I told her I was done praying. I was very quick in there because I just wanted to go back to my room. And then I was put back into my room. There's many instances, numerous occasions that she lifted me up and put me on her lap. She clawed through my hair. I was close enough to her almost at all times to the point where I knew she had permanent eyeliner. That's not something unless you're really close to a person. She would tell me weird details about her life. Yeah.
Let's show 25.
If you haven't seen it, you can go back to the live that I did on Kathy Beatty's testimony, and you will see Mr. Anderson, or hear Mr. Anderson questioning Kathy Beatty about whether or not she ever kissed Maya, and talk about the code of ethics. And she denies ever kissing her, but she does say things like, well, I would often comfort children. Maybe I had her on my lap. Maybe I hugged her. This whole thing is so far beyond the boundaries of the ethics of this social worker that it's nauseating.
597-18. I believe it's a photo of the chapel. And were you ever curious as to why she had you in the chapel?
So one really interesting thing about the chapel is there's no cameras. It's the only place.
Were you uncomfortable with Kathy Beatty's advances on you?
Objection, Your Honor. Argument.
Sustained.
Did
Were
these
you
incidents
uncomfortable?
with
That's not
Kathy Beatty
argumentative.
upsetting to you?
Yes.
Did they cause you to fear her?
Most certainly, and the whole photo incident truly solidified that.
We'll get to that in a moment. And was Kathy Beatty the only one that was tormenting you, if you want to use that term, but during this period of time?
See objection, argument. Overall.
No, there were other people as well. I mean, it was the doctors, through their words of accusing my mom and I of certain things, or, well, for me, I guess, accusing me of not having my CRPS. And then there was one nurse in particular, Ashley Sumner, who I had encounters with in the PICU.
Okay, I'm going to skip a little bit forward to the portion where she talks about Kathy Beatty taking pictures of her, because that is a large, important part of the case.
January 6th, right? So on that day, were you excited?
I was ecstatic. I mean, not only was I getting out of the hospital for a little bit of time, I was going to
January 6th is the date of the court hearing.
see my uncle, and the goal was to see the judge.
All right. And were you preparing for it? Try to get yourself ready? And
Yeah, I told people in the hospital, the people like the nurses and whatnot, I'm going to court today. I was excited. Yeah.
And so then what happened insofar as trying, what did you have to do before you were allowed to go to the court and see the judge? What happened with Miss Beatty?
So it was my understanding that I was just allowed to go to court because they ruled on it and I was allowed to come in person. So I was just expecting my uncle was going to come pick me up, and Kathy Beatty was going to wheel me down to meet with my uncle and put me in his car. Instead, Kathy Beatty showed up in my room a little bit earlier than the time I was supposed to go. She came in alone initially, and she told me that if I wanted to go and see my mom in court, I was going to have to be stripped naked and photographed by her nude, so I could go to court. I cried and cried because I'm a very modest and private person when it comes to stuff like that. I have been, and there's a reason for that. I really respect my privacy. And eventually I was able to reason with Kathy, and she said that I could keep my training bra on and my shorts. That's when she left the room. She came back with Nurse Alicia. I don't know her last name, but she came in and she assisted with holding me down and moving me and removing some articles of my clothing for the photos. Now, the purpose for these photos, typically, DCF takes them. DCF did not take these. And there's supposed to be a side-by-side comparison of pre-visit and post-visit. So I was leaving the hospital, so they took the photos before. There was never photos taken after.
And has it come to your attention that this did not end up in any analysis in the medical records or anything like that?
That's another thing I was promised in the whole reasoning with Kathy about not being nude. She told me that I could keep my shorts on in the training bra, and I specifically asked her to keep these photos private. I asked her if they were just going to be in the medical record, and she told me, yes, only doctors can see them. She actually physically went over to the computer where I've seen nurses and doctors put in information, and turns out she never put the photos in there.
All right, so let's turn to, first I'm going to publish a photo, 2604. And were you actively trying to keep them from taking off your clothes? No, that's not it. There.
Yes, so that, you see my hands right there, and then someone else's hand. I can't tell if that's Kathy's or the nurse's, but I was trying to pull up my shirt actively as she was pulling it down.
All right. And around this time, where we go into a few more photos, did you document this in your MyCare journal?
I believe I did. I haven't seen the MyCare journal in quite some time, so I would need my memory refreshed.
Let's look at this photo here. Now, it has been portrayed that you were somehow enjoying this and just holding hands. Tell the jury what was going on.
I was not enjoying this at all. It is true, when the nurse came back into the room, I wasn't crying as much because Kathy had calmed me down after we made that, agreement. We met in the middle. But you can see my cheeks are red, and that happens a lot when I've been crying.
Okay, and we can see a little corner of your mouth there. Are you smiling, grimacing, or what?
I am most definitely not smiling.
And is that a training bra?
It is.
Now, was there a time that you had to switch out of one bra to another?
Yes, so they're trying to maintain the position that, I was in a training bra and shorts, like we didn't, see anything. No, Kathy watched as I got naked because I was changing into clothes for court. That's why there's two different outfits. This was the same time period. There was no before and after photos.
All right. Let's look at 2604-15. There you are, blue shorts. Now tell us about the shorts. Did you remain in the same outfit during this ordeal?
No, because I was changing into court clothes.
Okay. So which are these, the blue shorts there? That's
I don't know which outfit I ended up wearing to court, but
okay. And then let's look at 2, 3. Oh no, we're going through these. Let's go through these. And now what is that? What kind of bra is that?
that's a training bra again.
Which came first, the training bra or the those are both training bras?
Both are training bras, correct? They switched them out.
So this wasn't a workout bra or anything? I
No,
don't know that
most
much
of
about
no.
bras. And did you tell them while were they holding you down through much of this?
Yes, and some of the photos you could see their hand, but it looks like the photos are mostly zoomed in, so you can't see their hand placement.
Did you want to leave and get out of there?
Yes,
And were they preventing you from getting out of there?
they were until the photos were completed.
And did you have any control or ability to get out of there?
No,
Physically?
because I couldn't walk or stand.
And this was against your will?
Correct.
All right, let's look at 2, 3, 6, 4, unless there's more of these we want to go through. That's good. You got 'em?
What happens, you guys, where I just swipe or something and it takes me off the screen, so I'm back. We were going to fast forward a little bit anyway on that video that we were just watching, so let's just give it a second. And you may need a tissue for this one as well. All right.
How did you learn about your mom's suicide? And tell us the first time you felt that this may have happened.
Oh, yeah, that's an interesting story. So, on the 7th, I'll never forget, January 7th, I couldn't sleep. Again, it was a combination of just pain and, my depression from being isolated from my family. So I was up until 2 in the morning. And I swear to God, I am not making this up. At 2 in the morning, I broke out in tears. I was just crying uncontrollably. And I called the nurse in and I told her, this was a nurse that I actually had a pretty good relationship with. And I told her, I miss my mom. I miss my mom. I love my mom. I want to go home to my mom. Turns out she ended her life.
Was that around that time that
Yeah.
you did? Okay.
That's why I always say that it was really January 8th that she died, not the 7th, because
You
I
felt
just
it.
have this feeling that it was then.
You felt it.
Mm-hmm.
All right. So how did they go about telling you that your mom was gone?
So I had a visit with my Aunt Wendy. I want to say maybe the day after or so.
Uh-huh.
So this was the 8th now. And something was off with her. And I asked her what's wrong. And she said, I don't know, just something happened earlier today. Sorry. So she didn't end up telling me then. I just enjoyed the rest of my visit with her as usual. And I'm not sure if it was that evening that my dad came in with my brother and Father Jack, but I know it was sometime close to January 8th. And I was sat down on the couch. My dad was I think I was maybe I wasn't in the wheelchair, maybe I was on the couch. My dad may have lifted me and put me on the couch, so I'm not sure about that specific detail. But my dad was right next to me, and right next to my dad was Kyle. In front of me was Father Jack. My dad said he had some bad news. And weirdly enough, the first thing I thought of was they're not going to let me home, or that I was going to be put in foster care. And it turned out to be even worse than that. My mom had died. So I was told that, and immediately after my dad had to leave.
Okay. How long was your family allowed in there to tell you that your mom had passed?
It wasn't a lot of time, if I'm being completely honest. It was actually so unbelievably cruel, the amount of time they allocated for me to spend with my family after hearing such awful news.
So after this now, if your mom was supposed to be the reason why here with this Munchausen thing, and your mom's gone, did they let you go?
Objection. I'd like to approach on this.
Okay, so they're going to approach on this, and it's going to turn out that Maya will not be released to her father's care until approximately a week later. So it wasn't as if she was just allowed to leave after her mother was no longer, even though it was her mother that was allegedly the cause of all of this and the reason that Maya was separated from her family. It's heartbreaking. I can't play any more of it because it affects me tremendously. Unless you have a rock for a heart, I'm sure that it affects you as well. So let's go to the chat for a minute. And then I want to play the testimony of the Dr. Napolitano from the Risk Management Committee, because if you are not already angry about this case today, you're just going to get a little bit angrier, although his testimony won't make you cry. Well, it may, when you realize what's going on behind the scenes at the Risk Management Department in this case. Let's go to the chat for a second. This is an interesting comment, I thought, Mark. As a jury member hearing a lot of objections while they talk about a specific person, it would kind of make me think this person is bad news and the defendant doesn't want me to know it. I agree. And so we need to think about, what is the jury thinking about? How are they perceiving this whole thing? And I would love to know. But every time an objection is made, I'm sure that the jury is thinking, well, that's something they don't want us to know. And sometimes it sneaks out and it's too late. Hello, Rescue Puppy. Thank you so much for becoming a member. Thank you, Ravonna Mills, so much for becoming a member. And yes, Becky, expert witnesses are always paid. And in fact, some of these experts, in my experience, have not billed nearly what experts in New York would bill. There was one expert witness that testified on behalf of the plaintiff that said that he was paid, I think, $11,000 for over 5 years of work here in New York, depending on the doctor and his schedule and his volume of patients and whether he's a surgeon. They can charge up to $15,000 per day of testimony, if not more, just for testimony. That's not including record review, reports, examining the patient. Experts are always paid and they're expensive. And in fact, there's another witness who came in to testify on behalf of the plaintiff that said he was testifying pro bono, means for free. And he spent a lot of time on this case, and his name escapes me at this very moment, but maybe I'm sure one of you in the chat can tell me. These cases are very, very hard, very, very expensive to prosecute. And most of the time, these types of cases are taken on contingency, which means that Anderson's firm does not get paid until if and when the case settles, or there is a verdict, or there is a payout. And they take a percentage and they lay out all of the expenses. So as far as I know, in Florida, works the same as in New York. The family is not paying their attorneys by the hour. In New York, it's standard to get 1/3 of the fee as a fee, plus your expenses, depending on the retainer. And in Florida, it may be different. It may be more, maybe 40%, it may be 50% if the case goes to trial. So these cases are very expensive. They take a very long time, as you can see. And there is a tremendous amount of work involved in but in bringing these kinds of cases on behalf of the plaintiff. Let's take a look at the testimony of Dr. Napolitano. I think I'm going to speed it up a little bit because we've already been in here for almost 2 hours. I can see there's, I don't know, 400 and almost 500 people in here. So if you wouldn't mind hitting the thumbs up while you're here, that would be great. It helps the algorithm. YouTube's got all kinds of analytics and algorithms, and you can subscribe down below. It's free. And also, if you hit the bell and set it to all notifications, you will be notified when I go live. So you will not miss a thing. You can also watch this on replay. So thank you also to all of my replay viewers. I appreciate you very much. And let's watch the testimony of Dr. Napolitano, shall we?
Doctor, would you raise your right hand for me, please? Do you swear firm testimony you're about to give the truth, whole truth, nothing but the truth, stuff you got?
I do.
Please state your name for the record.
Anthony Napolitano.
Dr. Napolitano, do you understand that you are appearing pursuant to a directive by the court that the defendants produce someone with knowledge regarding the risk management committee operations and issues regarding chain of command and control?
Yes,
And have you ever served on the risk management committee?
yes.
What years?
I would say 2014 through 2019.
And what was your position, if any?
I served as chair of the Department of Pediatrics.
Who else in 2016 was on the committee with you?
It would be the chair of the Department of Surgery and members of the risk management team.
You're real soft. Can you speak up a little bit on this?
Sure, it would be Dr. Kowalksi, the chair of pediatric surgery, and members of the risk management team.
And who is that at that time?
I don't remember all the names. It would be Jackie Crane would be the name I remember.
And she was the general counsel?
I believe she was.
Can you tell this jury, from the best of your memory, whether the risk management committee of Johns Hopkins All Children's Hospital ever took corrective action in any way about Maya Kowalski's considerations and situation?
Not that I'm aware. Not that I am aware.
How does risk management manage risk in real time?
We go back to our divisions and our care areas and look to see how we can help.
How do they manage risk in real time? That's the question.
So you do or do not discuss things happening in real time?
No,
No, you do not.
we do not discuss real time.
Anderson is so confused right now, he doesn't even know what to say next. You are the risk management department of the hospital, and you do not discuss things in real time? In fact, you're going to find out they only have quarterly meetings.
So if a physician or a group of younger physicians makes a mistake, to the best of your knowledge, there's no one at the hospital that is there to correct them in real time.
It's not in real time.
There was no one there that was reviewing what the hospital was doing in real time, correct?
In real time, no.
So for instance, if you had a social worker who was acting inappropriately towards a child patient, there was no mechanism by which risk management would intervene and try to stop that behavior. True?
No,
Did you know anything about, Doctor, did you know anything about what happened with Maya Kowalski?
I read about it. I read the article about 2 weeks ago.
But before that,
He read the article about 2 weeks ago in USA Today. That's how this doctor, who's on the risk management committee, the chair of pediatrics, found out about Maya Kowalski by reading about it in USA Today about 2 weeks ago. When was this deposition done? I don't know. We're going to have to look for a date on that. So 2 weeks prior to this deposition.
As a member of the Risk Management Committee, you'd heard nothing?
I had heard nothing about the,
Okay, I can see it in the corner, very, very small print. May 11th, 2023 was his deposition. May 11th, 2023. The first time he heard about the Maya Kowalski case, which happened in his hospital where he was the chair of pediatrics on the Risk Management Committee, was from USA Today.
case.
And what other positions did you hold? But before,
But I read the
I need
article
to rewind that
2
for a
weeks
second.
ago.
that, as a member of the Risk Management Committee, you'd heard nothing?
I had heard nothing about the case.
And what other positions did you hold during 2016, 2017? What other committees and things were you on?
The Department of Medicine.
What was your position?
I was chair of the Department of Medicine, pediatric medicine.
And in that capacity, you didn't hear anything about Maya Kowalski?
No,
All right, what else were you on? What other committees and organizations were you on?
I would sit on medical executive committee.
And as a member of the Medical Executive Committee, you didn't hear anything about Maya Kowalski?
No,
To the best of your knowledge, did anyone from the quality department, such as a vice president of quality, report to the Medical Executive Committee about Maya Kowalski?
no,
Do you have any idea why you, as the chief Department of Medicine chair, would not know about a child being kept at the hospital for this long, or 3 months, involving court orders and an eventual suicide of the mother?
the care is managed at the division level.
Managed at the what?
The care is managed at the division or the treating doctor level with their care. It doesn't come up to me. I would not hear day-to-day operations or care like this.
What? You're the head of pediatrics. You wouldn't hear anything like that? Is that because it happens so often? Because it seems to me that perhaps this did not happen very often, that this would be something that, as the chair of the department, he should be aware of, and that the risk management department should be aware of. And you may recall that attorneys Shapiro and Hunter were involved in this case in real time. They were being called, they were being consulted. So who was initiating that contact? If not the risk department, risk management. If it didn't, I'm blown away by this testimony, and I'm pretty sure you guys are too.
What remedies were available to the patient, most likely the patient's parents, if the doctors at the treating doctor level were misdiagnosing or otherwise negligent in their care of the patient?
Check the form.
They would ask to speak with the division chief and ask to sit down and speak with him or her to discuss the concerns they had.
All right, and with Maya Kowalski, they're under allegations of child abuse. Who would that fall under as a division chief?
That would, for the care or for the
Both.
care of the patient,
Yes.
that would be the division chief of hospitalist medicine.
So I know you didn't learn of it till recently, but you do know Maya was there under a court order, correct?
My knowledge is really from what I know from reading the USA Today article that I read.
Still to this day, to May 11th of 2023, all he knows about this case is from what he read in USA Today. Let that sink in.
Okay. And who was responsible then for assuring Maya's care was aligned or complied with a court order?
That would be the physicians caring for Maya.
And if the physicians were not monitoring the nurses and errors were made in her care, how would that be corrected? So the child was no longer injured, hurt, or troubled.
It would be the nursing manager of the floor that Maya was on.
As chair of pediatric medicine, do the hospitalists belong to your department, pediatric medicine?
They're one of several divisions, yes.
The ones that what?
Yes, they would. The hospitalists fall under the Department of Medicine.
All right. And so during 2016, who were some of the hospitalists that were under your authority, if you will?
At that point in time, and this is reading from the article, would be, I think, Dr. Deese was one that I read, and
Who was it? Sorry.
Dr. Deese.
Again, he's getting this information from reading the article in USA Today.
Okay. Anyone else? Dr. Major?
She would be a hospitalist, yes.
Let's see, how about Dr. Young,
Dr. Young, yes.
Dr. Carroll,
Yes.
Dr. Davidson, Danielson, excuse me, I'm sorry, Danielson.
The first name on Danielson is who?
Kristen,
Would be a hospitalist, yes.
so she'd be under your care, or your
Under
authority.
hospital.
Okay, and throughout this period of time in the fall of 2016, did any of your hospitalists that we've mentioned here ever come to you with any concerns about the actions of any fellow doctors, nurses, or social workers?
No,
Nope. Nope.
If they had come to you and said, the patient's complaining that she's being tortured every time she has to do this type of physical therapy, what would be the procedure? And that's an example. What would be the procedure then, once you receive that report?
I would speak to the division chief to understand what was happening, as for reporting what's happening.
Well, who is the division chief for that? What division are we talking about?
The hospitalist.
Well, who was the division chief in 2016 while all this was going down?
I don't remember. I have to go back. We'd have to go back and look.
To the best of your knowledge, has Johns Hopkins All Children's Hospital done anything to change the way it operates since Beata Kowalski's death, Maya's stay there?
No,
No, it's done nothing. It's done nothing to change its policies and procedures since this happened in 2016, early 2017. Again, he's speechless. He's never
In fact,
speechless, Mr. Anderson.
Most of the doctors, nurses, and staff like you don't even know what went down, do you?
from the article that I read is how I know about it.
But internally, coming from within the hospital, nobody ever brought to your attention what happened there. Is that right?
No,
Okay. And who was there to make sure that the patient's rights, as stated in this particular document, the guide for patients and families, who was there to make sure that the patient's rights under that were being upheld, honored, if you will?
the local leadership, the managers of the unit, the nursing managers of the unit, and the physician, the division chief.
Well, you just testified now that you don't treat adults. Who there is qualified to diagnose a parent as having a mental illness?
We don't have adult providers at the hospital, so we really do not manage adult care.
Okay. So who at the hospital was qualified to diagnose Piata as having Munchausen by proxy, which is what set this whole chain of events in motion? I know there's a lot of people out there that want to point the finger at DCF, but understand that DCF and the court, the juvenile court proceedings, were relying on the reports of the hospital and of Sally Smith, who may or may not have held herself out as being affiliated with the hospital. And if people like him don't know what's going on, I'm telling you right now, in my opinion, the jury's pointing the finger at the hospital on this because they could have stepped in. They knew nothing. They knew nothing, and so they did nothing. And they let Sally Smith, they let the fox guard the hen house, and that is going to still fall back on them.
I take it the answer to your question is there isn't anyone there that is qualified to diagnose adult psychiatric issues.
Yes,
And that was true in 2016, correct?
yes.
To be the end.
That's it.
Then we announced the date. It's a bit hard to read on that deposition. No, it's still going.
It's still going.
Oh, it is.
All right. So
Long break.
I'm going to ask you now about some allegations you haven't heard from your testimony other than popular media, and ask you whether these comply with hospital policy. Maya's priest was prevented from seeing her. Does that comply with hospital policy?
I'm not aware.
Okay, she was prevented from having a computer or any electronic devices. Is that part of the hospital's policy generally with children? Not being allowed to have any food, any baked goods from parents or even her little friends. Is that hospital policy?
If a patient was on a specific diet, potentially.
To strip her to her underwear, short shorts, and physically hold her down to photograph her. Is that part of hospital policy?
I'm unaware.
All right, what about listening in on calls with her lawyer? Is that hospital policy?
I'm unaware.
Do you report to anyone in Baltimore?
No,
Have you ever?
no,
Is it true that the hospital, all children's, continue to operate with essentially the same staff and same procedures and same level of care after Johns Hopkins bought it as before Johns Hopkins bought it?
yes,
If there's a truly egregious event at the hospital, and I assume there has to have been some over your tenure, what is the most direct line to the president?
I'd go to the president of Johns Hopkins Old Children's.
Do all department heads have access directly to the president?
At that point in time,
Yes.
2016.
Yes.
Yes,
Okay, so what divisions are part of your department?
at that time.
Sure.
So it would be the cardiology, hematology, oncology, critical care, hospitalist medicine, genetics, infectious disease, neurology, rheumatology.
Well, if you had, then you would have had control over all of the doctors we mentioned from one department or the other, would you not?
I'd have a good deal on the medical side.
All right, and then how often would you have a meeting in 2016 with the heads of the departments?
We would try to meet monthly. Not everybody would attend, but we try to meet monthly.
And in terms of the discussions, do you recall any discussions, even in the general terms, about a child that was being held by court order in the hospital for a long period of time?
No, that would not come up in the division meeting.
No, that wouldn't even come up in the division meeting. Wouldn't even come up.
How many times have you ever heard of a child being kept at your hospital for over 3 months against their will?
I'm not aware of that.
And so still, if that in fact is true, that that was the circumstance, Maya was being held for over 3 months against her will and her parents' will at the hospital, that was not a significant enough event for any of the department heads to bring up?
No,
No, no, let that sink in. Let that sink in if you're sitting on the jury trying to figure out whether the hospital has any liability in what happened during the 3-month stay and the course of events that occurred therein with regard to this case.
I see. So it doesn't really matter if the child feels that they're a prisoner, the patients feel the child is a prisoner. You're going to stick to your, what did you call it, methods of care?
yes,
Doesn't matter. None of it matters. We're still going to do what we want.
And this was from May 11th, 2023?
Yes, Your Honor.
Okay. Can I see the attorney for a moment?
That's it. That is the testimony from the witness that they produced on behalf of the risk management department. Okay, I'm sure you guys all have a lot to say about that one. I'll have to say a lot about that one. Oh, Sarah, thank you so much for your super sticker. And for grace is just, that's a part of my nature. And that's a part of what we're trying to do here. So Sarah, for those of you in the chat who are just joining, is afflicted with CRPS and has been a wealth of knowledge with regard to the condition. And there are several other members of the chat who are also diagnosed with CRPS and have really enlightened us as to what the symptoms and the chronic condition entails and how painful it is. What does it mean to be a recovering attorney? Well, it's partially a joke, but it means that that although I was in practice for close to 30 years, I've been a licensed attorney for 30 years, I have pivoted to other things. I'm no longer taking clients, actively taking on new clients. I am now also a legal analyst, mother of 5. I'm very busy, YouTuber, and I'm also, when there are no strikes in progress, a working actor. So I have second and third careers here. And being a lawyer was a very long, I'm still a lawyer, I have my license, but I'm just not actively taking on cases right now. This, I think, KKHE Flynn 3. Did you also put this in my comments? Because I saw this and I found it so interesting, and I'm really so glad that you're bringing this up. She says, my friend who is a CEO of a major city hospital is revamping her risk management department because of this case. She's horrified at the behavior of Johns Hopkins. And that's what we were talking about before, that perhaps this will bring about some change in the industry and some change in the not only what goes on in hospitals internally with their risk management departments and their policies and procedures, but also with the DCF system and the privatized DCF system that is a large part of this case. Oh, thank you for that, Elizabeth. I've known a lot of kiddos under the care of DCF and they were never treated like Maya. The hospital chose to treat her that way. I happen to agree with you. And like I said earlier, for those of you just joining, this is not the first time that Sally Smith has been involved with what plaintiffs are alleging were improper and incorrect diagnoses of Munchausen's on behalf of the parent. There are several other cases pending, and there is one gentleman, in fact, who was a father who spent 300 days in jail before Sally Smith's allegations of Munchausen were dismissed. And they were unfounded. There was also a prior contestant on American Idol who's been very, very vocal about this. The same thing happened to her, where one of her children was taken away at a very young age. I believe the child was, I can't recall, I don't want to misquote, but very, very young. And that while that child was taken away and in state custody, she gave birth to another child. And the law enforcement came and took that child away as well. So this runs deep, and it's very, very horrifying. And the fact that this could happen to you should also scare the bejesus out of you, because it can happen, and it is happening, and we're shining a light on it here. So this is what I feel compelled to do about this case. I feel like this case is far bigger than the Kowalskis. I feel like, tell me what way you think this is going to go, you guys. You think they should open up their checkbook? I don't know if they've tried to settle the case. That kind of information is not usually made public. So look, the jury could award $1. They could award $200 million. They could award more. There's some sort of a cap on damages in Florida. We don't have that here. So I'm not really, familiar with exactly what their cap is. I think the punitive damages can only be 3 times the compensatory damages. So for example, if they award $50 million in compensatory damages, they would only be allowed to award 150 in punitive damages. So I believe there are some caps there. Not really up on the nuances, but I do know that much, at least from another YouTuber who actually practices in Florida and has not been able to cover this case as in depth as he would like, because as I told you on another live stream, if I was actively practicing and this case was in New York, I would likely not be able to cover it either, because the chances that I would have cases against this particular defendant, and I would probably know these defense attorneys, and I probably would have cases with these defense attorneys, and it could be considered a conflict of interest. So I would not be able to opine and or analyze a trial in which I had cases with the same defendant, or the attorneys were my friends, or the attorneys were my adversaries in certain cases. So that is what I learned from that YouTuber who I respect, who practices in Florida. So with regard to the defense case, which I believe started, today's the 18th? Was it only yesterday? I feel like, no, I think it started the day before with Dr. Lewis, correct? Dr. Lewis was their first witness. And then yesterday we saw testimony. For those of you, I usually listen to it in my car. And like I said earlier, I was listening to it in my car and I was thinking, wait a second, is this the defense's case? Because some of these witnesses were so, I thought, good for the plaintiffs. You may disagree with me. Certainly tell me respectfully in the comments. I do not like the cursey words. I know there are some other YouTubers who love cursey words. I'm not one of them. So try and keep your comments clean. Try and keep the, I'm all for respectful debate as long as it's respectful. If the comments are nasty, they're just going to get deleted. Thank you so much to my moderator, because they really are the best on YouTube. They police this chat like nobody's business. And that's why we consider it to be a safe space for people who have been falsely accused of Munchausen, for people who have children with CRPS, for people who are suffering with CRPS, for people who are suffering with other chronic diseases, who understand this case a lot more than a lot of these hateful chatters on the live streams that I have seen on the law or the news channels that are streaming the trial live. It's kind of horrified me, the chats in those other places. And that's why I'm doing this as a place for people to feel like they have a safe space to talk about their experiences and their opinions without being excoriated and publicly shamed in other chats. I'm horrified by it. So as we were saying yesterday, the defense called Charlotte Laporte, who was the Kowalski case manager. She came in and testified that it actually was her voice on some of those phone calls that were played that Beata had recorded. I think Maya had testified that it was Kathy Beatty's voice. She came in basically to say that was me on those calls. Although Kathy Beatty, I believe, did also supervise some of the phone calls between Beata and Maya. We also saw testimony from another witness by the name of Tori Niehaus, who was the safety monitor for the Safe Children Coalition. And her testimony was riveting. And I do not think that it did any favors on behalf of the defendant hospital. Even though she was not employed by the defendant hospital, she was a hostile witness in many, many ways. And although I feel like she in her own mind, was doing her job and doing her job very diligently the way she was supposed to. I do not think that it helped the defense at all. There was also some additional testimony yesterday that I did not personally watch. So we're going to wrap this stream for now. If anybody else would like to come back later, maybe tonight, and watch just that testimony with me of Torini House, just put a Y in the chat or in the comments and let me know. Hi, Jason Smith. I love your stealing. I have my poster up here from the most recent Dead and Company tour. I think that was from the forum. So also Deadhead. She was lying, in my opinion. That was Beatty's voice. I don't know. I don't know if it really matters so much, you know. Matt Bond also has CRPS. Thank you so much for your $5 or Australian dollars or I'm not sure. Super chat. Thanks for the coverage. It's crazy how many attack us in the main court streams. I would tell them walk a mile in our shoes, but I can't wear shoes. Yeah. It's so painful that Matt can't even put his shoes on. Let that sink in. It is the number one most painful disease known to man, CRPS. Number one most painful. Okay, some of you guys do want to watch. I'll see what my schedule looks like tonight. So if you guys want to come back and watch that, it's riveting and we can speed it up, but I just don't think that she did any favors for the defense at all. At all. So in my opinion, and this is my opinion, and you can let me know what you think in the comments, I'm not feeling like the defense witnesses are helping them. I think in some ways they're hurting them. I think that every defense witness we've seen, I don't think we've seen any compassion in any of the defense witnesses. Tell me if you think I'm wrong. Does anybody know if they are going to be calling Sally Smith in person? I had heard that rumor, but I haven't heard any more about it. So if the defense is calling Sally Smith live to the stand, I would love to cover that live. I just need to know when it's going to be. So let's, if you guys could let me know, that'd be great. Also, it's interesting that when I first started covering this trial, there was hardly any interest in it and the numbers were low and there were not a lot of people watching. But I think during the time that I've been covering, I don't know if this is my 5th or 6th video on this trial, the audience has been growing here because I think you guys know what I'm all about. And I'm not going to try and be neutral and I'm not going to be mean. And I'm just, it's me. It's who I am. I'm not a cupcake. Like it or don't. Change the channel if you don't like it. There's been a lot more interest in this case, I think, as the coverage has gone on from all avenues, from the news talking about it, from people talking about it, from people realizing what a big issue this is and how scary this is. And I'm glad that it's receiving a little bit more notoriety than I thought it was getting in the beginning, because look, we're all true crime fans, right? We were here for the true crime. We love true crime. This is a civil case, so it doesn't receive as much attention. But look, Johnny Depp and Amber Heard was a civil case too, and that was also an important case. So I'm glad you guys are here for it. Amber, I completely agree. I also don't understand why the hospital's continuing to double down with their witnesses after hearing jury questions. I know. If you've listened, this is another interesting difference between New York and Florida. In Florida, the witnesses, the jury is allowed to ask questions of the witness. So after every witness is finished with their testimony, the judge says, jury, do you have any questions? And they're allowed to take notes as well. And they're furiously writing their questions down. And then the judge collects all the questions. And then the attorneys come up for a sidebar to decide what should and should not be allowed to be asked based on the rules of evidence and other things that have been allowed or excluded from evidence already. And then the judge asks the witness the questions from the jury. And if you listen to these questions, they are so well written. They are so well reasoned. These jurors are intelligent. I would not be surprised if one or more of them is in the medical field, because they seem to have a lot of knowledge about medicine and about procedure. If clearly, I believe there's more, at least one or more parents on the jury, and you can see the way the jury is thinking and the way they are leaning based on the questions they are asking. And I didn't really think any of the questions they asked Maya were as important as some of the other jury questions that we've played. But when we get to Tori Niehaus, we will see how interesting these questions are. And in my opinion, they are leaning towards the plaintiff. That's my opinion. You can agree with me. Thank you again to all of my moderators. Wait 1 second. Hostile witness. If you could explain hostile witness, and then might the defense want to request the court to treat a witness as hostile? Thank you. Well, a hostile witness is typically one, exactly what it says, is going to come on and testify in a hostile manner. If you call a witness, typically they're going to testify in a way that's favorable to you. But if they start being not answering the question, being argumentative, or in some other way going outside the bounds of what is reasonable, you can ask to treat the witness as hostile, which means that you're allowed to lead them in their questioning, basically. Does that make sense? So typically, somebody said to me, why didn't the plaintiff ask to treat Dr. Kirkpatrick as a hostile witness? And Dr. Kirkpatrick wasn't being hostile. He was just talking a lot, and he was going, he was answering, he was expounding his answers and going on and going on and going on. It's not really a hostile witness. It's just more like, doctor, could you please just, confine your answer to my question? It's never really a good look to ask to treat a witness as hostile, in my opinion. But sometimes there are times when you have to do it because the witness is so out of control that you need to be able to regain control over them and ask them questions in a leading fashion to get the testimony out of them, if that makes sense. Team Brittany, a huge spotlight needs to be on this hospital. Yes. Okay, they do say that she's going to testify live. Okay, maybe we'll find out more. I think they're doing jury instructions at 3:30, so I may pop in and listen to that for a little bit. That also, if you're interested, gives you a little more insight as to what the law is and what the plaintiff has to prove in this case. Remember, there are only 6 members on the jury, and in Florida, all 6 must be unanimous, which is also a difference between New York and Florida. In New York, we need 5 out of 6. And in Florida, they must be unanimous. They're saying she's testifying. Oh, Rochelle's always on the Google for me. Thank you, Rochella. All right. Later this week, well, it's already Wednesday, so that's either tomorrow or Friday. I guess we'll know more later. All right, everyone, have a wonderful rest of your day. Thank you to all of my moderators for keeping the chat classy. Thank you to all my new members. I'm so happy to have you. Thank you for all of my viewers and all of my replay viewers. If you wouldn't mind just hitting the like button on your way out and helping the algorithm, don't forget to like and subscribe. It's free. And if you're interested in becoming a channel member, I have 4 levels of membership, and it's going to be really, really fun. We just started memberships about a week ago, so you're getting in here on the ground floor. Thank you so much. Love you guys. Keep it real, keep it classy, and I'm going to see you soon. Hit the notification bell so if we're going to do the Tori Niehaus thing tonight, you'll know. Bye-bye.